Down in Lowell, it's a really quick drive up here, so we brought him up. He brings some good information. He's going to kind of talk about his methodology that he uses to develop his programming down there at Lowell, and hopefully you guys can take something from that and apply it, like I said, to your clients and athletes. So, Devan, go ahead.
Hi, thank you. As Justin said, my name is Devan McConnell. I'm the director of sports performance at UMass Lowell. I oversee everybody, all the teams there, but I'm day-to-day with the hockey team. So we're going to talk about methodology a little bit and kind of our system of training. Again, specifically talking about hockey and some examples with our hockey team, but as you'll see as we go, kind of my belief, our methodology is that training is training, and this can really apply to any team, any athlete, and it certainly is pretty similar to the way we do things with hockey, basketball, baseball, etc. So to start off, I just want to say thanks to everybody. First off, my wife for putting up with me, doing the presentation, and spending an off weekend up here in Vermont. Everybody in attendance, I appreciate you guys coming and listening to me. Mike Boyle and my other mentors, that have helped me get to where I am in my career at this point. The NSCA and UMass for putting on this clinic. And of course, my current employer, UMass Lowell Riverhawks, for allowing me to do what I do. A little background, Justin already kind of touched on it, but I grew up in Seattle on the West Coast. I attended Fitchburg State College, which is in Massachusetts. Went there to play hockey. Began my career at Mike Boyle Strength and Conditioning, working for Coach Boyle. Been fortunate enough to spend some time with both the Anaheim Ducks and the San Jose Sharks in the NHL. Spent a number of years at Stanford in California, and now in my current position at UMass Lowell. So I wanted to have sort of a definition to work off of here as far as methodology, so we're all on the same page, what we're going to talk about. A methodology is usually a guideline system for solving a problem with specific components such as phases, tasks, methods, techniques, and tools. So today, hopefully, what we're going to be able to talk about, and I'll be able to explain what we do, our system of training, how we sort of define and solve problems within sports performance, and then what phases, tasks, methods, techniques, and tools we use to solve those problems. So that's what we're going to try to explain. Topic for today, just a table of contents, if you will. Start out talking about philosophy, okay? What do I believe in training, and how that kind of drives everything that we do. What are we trying to achieve? Okay, defining those problems, figuring out exactly what it is we're trying to influence. Systematic approach to training, how we do things, define our framework a little bit, our template, I guess, a standard operating procedure, what are some of the tools and techniques that we use that are common in our training, and then hopefully at the end be able to tie it all together and make some sense of all of it. So I'll start out with philosophy. First and foremost, as a collegiate performance coach, I take very seriously my role as a teacher and a mentor. I think ultimately it's our job, especially in collegiate sports, to guide young people sort of on their path, from kids to being adults. So I think that that's really, really important, and overall that's the big goal. That's what we're all trying to do in a larger sense. Teaching and developing character is very important, and it's something that's always it's always in the back of my head every day when I go to work. Right? That's the ultimate goal, is to improve or to develop character, not to improve character. Education is key to this. It's also key to buy-in. I want our athletes to understand why we're doing what we're doing. That increases buy-in tenfold. If they understand when they come into the weight room with me why they're doing a certain exercise, why it's a certain amount of weight, the sets, the reps, every detail of the program, it's going to create better buy-in. They're going to work harder, they're going to understand, they're going to take personal ownership of what we're doing. Instead of just me telling them they have to do something, now they understand why, now they buy in, now they work that much harder. So teaching and developing character is the overriding philosophy. Education is a key component to that. But what we're really going to talk about is the training philosophy and training methodology. And what we work under is what I call a movement-based approach. And what that means is everything that we do in the weight room ultimately needs to lead to better movers on the ice. Okay, if we're doing stuff in the weight room and they're not better on the ice, they're not better on the court, on the field, we need to ask ourselves why we're doing what we're doing. So everything we're doing follows a movement-based approach. Within that, we have two goals. The primary goal is always to reduce the incidence of injury, okay? Our number one job in sports performance is to keep our athletes as healthy as possible. If we're healthy, if our players can practice every day, if they're available to play every weekend, we have a pretty good chance for success, okay? If they're hurt, they can't contribute. They can't help themselves, they can't help the team. So number one goal is always to try to do things to reduce the chance of injury. The number two goal is obviously then to improve performance. Okay, we do want bigger, faster, stronger athletes. When we talk about improving performance, the key concept is developing athletes. Okay, we want to improve athletic ability. We want to improve the underlying qualities of athleticism that sports skill is built upon. So a little more movement-based approach. As I said, everything we do in the weight room should lead towards better movement on the ice, okay? I don't believe in work for work's sake, all right? There's plenty of hard work that we can do that's productive, that leads towards improving both of those goals, that improves the ability to move, that's really hard, that accomplishes those goals. We don't need to spend time doing hard work just because it's hard, you know, just to get work done, okay? Everything we do should have a purpose. Every detail of our program has a reason, it has a purpose, it has a place. When our athletes come in as freshmen, one of the first things I tell them is that everything we're going to do has a reason, okay, a specific reason. Every set, every rep, every exercise, every posture, every breath, everything is accounted for, everything is thought about. So if they have a question, I want them to ask me, why are we doing this? Because again, education is key. I want them to understand why we're doing it, and if I can't explain why that's going to help them as an athlete, them as a hockey player will take it out. I tell them that day one. I make sure that I know the answer to everything so that doesn't happen. But that's a key component. Everything that we do should have a purpose. When we're talking about quantifying movement, if that's kind of the gold standard, well, how do we account for that? How do we evaluate that? We do it in two ways. The first way, we utilize the FMS, okay, the functional movement screen. If you're not familiar, it's a 7-part screening process, takes 10 minutes per athlete, and it just shows sort of functional versus dysfunctional movement, left to right asymmetries, and throws up red flags for injury. Okay, it's a really quick and easy way for us to just get a baseline on our athletes when they come in and be able to evaluate as we go if they're improving in these qualities that we find to be important. We also use it as a check and balance. So we'll use the FMS 2 to 3 times a year, usually beginning, middle, and end of the year. And it just lets us go back and check our work and make sure that if an athlete comes in at the beginning of the year and their FMS scores aren't very good, that at the midpoint, at the end of the year, those poor scores should be improving. If they're not improving, we need to evaluate what we're doing in our training. Likewise, if we have an athlete who already moves well, and now their movement abilities are decreasing over the year, again, we need to go back and look and make sure that we're addressing those types of problems. It also throws up red flags right off the bat, so if somebody has a movement impairment or pain with certain movements, we know right away to be able to outsource them to athletic training, physical therapy, and make sure that they get a more thorough screen. And then we also don't load dysfunctional movement and make a problem worse than it already is. Performance testing is the second way that we evaluate movement. When I talk about performance testing, I'm talking about things like 10-yard dash, vertical jump, 4-jump, our shuttle conditioning test. These are the numbers that we're most focused on improving, okay? And really what we're looking at when we look at performance-based tests are testing the efficiency of movement, okay? If somebody's 300-yard shuttle improves, they're more efficient at covering that ground. You can break that down and look at is it a cardiovascular improvement, is it a biomechanical improvement, a strength, a power? You can look at all that, and we do. But right off the bat, you're getting an indication of, are they more efficient at that movement, at these movements that we find important? We also think that every exercise is a test, and every test is an exercise. So we're constantly looking at movement, we're constantly evaluating how our athletes move, we're constantly coaching movement, okay? And I'll get into it a little bit, how we structure things, but we want to make sure we're always trying to refine and coach and improve the ability to move. So those are our key components, and those are the two ways that we quantify our movement. So what are we trying to achieve? Okay, defining a problem. We break it up into 2 categories. First, we look at injuries and the issue of injuries around sport, and then athletic development. Okay. When we talk about injuries in sports performance, what we're mostly talking about are non-traumatic injuries. Okay. In hockey, if a guy gets hit from behind into the boards, separates his shoulder, there's not a whole lot that we can do in sports performance training that's going to prevent that. If Gregory Campbell from the Bruins goes down, blocks a shot, breaks his leg, well, not a whole lot that I have influence over that. What we do have influence on, in my opinion, are non-traumatic injuries and common injuries in hockey, soft tissue injuries around the hip flexors growing, hamstrings, okay? Again, things happen in sport, things happen, but we want to make sure that we're not having chronic injuries and we're limiting these problems, okay? So we need to make sure that we're doing things that address soft tissue problems in areas that are of common problems. Another area in hockey that has a lot of injury potential is pelvic dysfunction. Okay, femoral acetabular impingement, FAI, and labral tears are a huge problem in the hockey population. I was at a conference a couple weeks ago, and somebody had a slide from a very recent study by Dr. Philippon out in Colorado, who deals with a lot of FAI. He's one of the first people to kind of look at this, and it was really alarming. He looked at youth hockey players, peewees, bantams, and midgets. So peewees, 12, 13 years old. 37% of the athletes he looked at already had signs of FAI and/or labral tear, of 12 and 13-year-olds. Bantam age players, 14 and 15, that number increased to somewhere around 63%. At the midget age level, 17 and 18, the number was 93% of the kids that he looked at. So almost every competitive hockey player that's 17 or 18 years old, 93% of them have these major dysfunctions, these bony adaptations to what they're doing, and labral tears as a result. So what's the chances when I get a kid at 20 years old that he doesn't have that issue going on? Every one of them has it. So that's something we need to look at in our training. Okay, if you've already got bony adaptation from bone rubbing on bone within the hip, there's not a whole lot you can do to reverse that without surgery. But we want to make sure that we're not adding to that problem, and we want to make sure we're doing little things to try to mitigate those issues. Okay, so we're not making them worse over the course of time. When we talk about athletic development and the problems on that side, what we're really talking about are improving athletic qualities. So, we basically try to break it down. Basic qualities: power, strength, movement efficiency, flexibility, stability, mobility, and energy systems. Okay, these are kind of our key categories when we talk about athletic development. And these are the things that we need to look at in sports performance training and develop a plan to improve these qualities. Okay, we need to define these problems so we know where we're starting from and where we're trying to get to, so we can develop a roadmap. So reducing injuries, what are we actually doing? What does this mean? What do we do in our program? There's a couple things that I think are really key in our methodology that go a long ways to reducing a lot of these injuries. The first one is our daily movement prep. And I'll preface this by saying that I'm in a position at Lowell where I'm primarily with hockey. Our weight room is off of our rink. It's in our arena. I'm with the team every day. I travel with the team. I'm basically full-time hockey. So I'm with these guys every single day. I have the luxury of being able to do this. But what we do is I run the warm-up every single day. And the way I look at it is I basically get my athletes 15 minutes. I get a 15-minute training session every single day. So every day before practice, before every game, before every lift session, they're with me. Okay, so our movement prep that we do every single day is pretty detailed, and it's coached. It's not just kind of get warm and then get loose and get going. It's really specific to what we're doing. Some of the things we're trying to address within that movement prep: tissue quality. Okay, so we're trying to improve the quality, the density of muscle tissue, and then improve the length and the range of motion. Movement efficiency. So we're trying to improve movement patterns. Make sure that our biomechanics are sound, that our movement technique is efficient, okay, and we're always teaching these things and coaching these things. And then trying to reinforce these patterns, so we're constantly going over these. We're always drilling how to move properly, how to cut properly, how to squat, how to hinge, all these things that we find to be really important. In movement, we're working on these every day. So we give 15 minutes every single day to hammer on these things all year long. Unilateral training is another key component in our methodology. Okay, when I talk about unilateral training, I'm talking mostly about single leg type work. The reason I think that that's really a really key component in our methodology: sport happens on one leg primarily, and if it's on two legs, in my opinion, it's unbalanced. Okay, the skating stride is essentially one leg at a time, or when you're turning or you're on 2 feet, you're on balance. You're never kind of statically in a single stance. So we need to make sure we're addressing those things. So we do a lot of unilateral training. The lateral subsystem is engaged to a much greater degree in unilateral stances than in bilateral stances. Okay, when you're in a bilateral stance, it's primarily a sagittal plane type exercise. When you're in the unilateral stance or offset stance, okay, now you have rotational forces and instability, things like that. So that needs to be accounted for. Increased proprioception, okay, when you're on 1 foot or you have a dumbbell or a weight or whatever in one hand, okay, there's proprioceptive feedback that is important. That again, in sport, you're not primarily on 2 feet, so there needs to be a time when you're working on unilateral type work, because that's going to occur in sport. And unilateral training, as I kind of touched on, as soon as you pick up 1 foot, an exercise becomes multi-planar, okay? Bilateral stance, I'm primarily sagittal. Unilateral stance, there's now rotational force, transverse plane, okay, frontal plane forces. And again, in sport, these things occur, so we need to account for them. Progressions are also a key component in our methodology, okay? We need to be able to progress and regress to individual competence. So if you came into our weight room, our freshmen and our seniors are not necessarily doing the same thing. Okay, they may be working off of similar categories and similar patterns, but more or less complex motor patterns. Okay, because they're different stages of development. We need to develop basic skills first. Every exercise, we look at every exercise we do, every movement we do as a skill. Okay, it's not just about moving a weight, but it's how well do we do it, how efficient do we do that, how, whatever the quality is, if we're working on speed and power, we need to think about efficiency and technique to that as well. When it comes to improving performance, okay, the key here in my mind is we think about developing athletes. A good athlete is a good athlete. It doesn't matter what skills you put on top of that. I'm convinced that somebody taught LeBron James how to skate and stick handle, he'd play in the NHL. He's a freak athlete, right? He could do anything. Another example is Michael Jordan. Everybody likes to make fun of Michael Jordan for when he took a year off to go play baseball in the middle of his career, and it was a colossal failure. I look at it a different way. I look at a guy who was arguably the greatest basketball player of all time at sort of the peak of his career. He decided that he was going to leave that sport and go pick up a new sport that he hadn't played competitively for maybe 15 years. And he was able to do that at the minor league level. He wasn't an all-star, okay, but he went and played minor league baseball. That's pretty incredible. That's athletic ability. And when we're talking about improving performance, we're talking about improving athleticism. I put this picture up here. I thought this was a great example. Guys obviously playing volleyball, bumping a ball here, muscles, deltoid, trap, vastus lateralis, etc., etc. If you move that ball down to his feet, call it a soccer ball, call him a soccer player, do any of these muscles change? Do any of the joints change? Does the technical ability to move of any of those joints and muscles change? It's all the same thing, okay? So, irregardless of the skills of sport that you put on top, movement is movement, okay? So, if we're thinking that way, then we need to ask ourselves, are we training sport-specific or human-specific? Okay, in my mind, all human bodies have the same basic movement requirements, okay? So the bulk of what we're doing needs to look at basic movement, human movement. How do we address those things, okay? The nervous system works the same way in a football player, in a hockey player, and a basketball player. It's the same nervous system. Different skill, same nervous system. Different ankle, or the same ankle between a basketball player and a soccer player. Okay, there's certainly injury trends that we need to look at. There's energy system differences between sports. There are some specifics, but it's a small piece of the puzzle in my mind. Another key concept here is I'm not an expert in skill development. All right, I was a collegiate goaltender, but I am nowhere near the goalie coach that our coach is on the ice. You don't want me teaching our goalies how to play goal. Okay, when I worked at Stanford, I worked with women's basketball. I have never played basketball in my life. I cannot make a layup to save my life. You don't want me teaching an elite women's basketball player how to do any type of skill work. You certainly don't want it in the weight room. That's not going to be the right place. I am good at improving movement. I'm good at looking at the nervous system and understanding how to address those issues. So that's my area of expertise. So human specific or sport specific? In my mind, we need to look at the human body as one. So we have these two categories. We have injury prevention, okay, or reduction, and we have performance training. So where's the line, right? What part of what we do is reducing injuries? What part is improving performance? I don't think there is a line, okay? I think it's all the same. I don't know how well you can see the picture, but this is a guy named Charlie Weingroff. He's got a DVD series called Training Equals Rehab, Rehab Equals Training. Charlie's a unique guy, if you've ever met him. He's a strength coach. He worked in the NBA. He's a really, really bright physical therapist, and he's also an elite powerlifter. He's got a really unique outlook on the training process, okay? What he's talking about in his DVD series is that no matter where you are on the training continuum, whether it's rehabilitation, whether it's elite performance training, it's movement, okay? And it's, again, it goes back to that idea of human specific. It's the same human body. I agree with that premise. I think if you're a physical therapist, an athletic trainer, a sports performance coach, a personal trainer, anybody in any of these kind of interrelated fields, we're all doing the same thing. We're trying to improve movement. We're just working at different points of that movement continuum. Okay, as an example, you might have an AT or PT working with a post-ACL rehab patient working on passive range of motion, flexion, extension of the knee. Okay, 6 months later, that same athlete might be with me doing loaded barbell squat jumps, trying to increase force output, power production, et cetera, et cetera. What are they doing? Flexion, extension of the knee, and some other stuff, sure, but it's movement. It's the same movement, it's just different points on that continuum. Okay, so we're all doing the same thing. We're all trying to address movement. If that's our goal, then how do we get there? Okay, as I said earlier, we have a real strict or a real kind of standard framework, I guess I could say, a template, so to speak, that we utilize. Okay, that allows us to kind of plug and play what we're going to do. We basically have three categories that we think about in our methodology. We have a warm-up, we have a lift, and we have energy system development. Okay, in any given off-season program, all of these things, pretty much all of these things are going to happen on a day-to-day basis. Okay, our warm-up, we're going to start out, we're going to address soft tissue quality and soft tissue length. Okay, so we're going to do things like foam roll or massage stick to try to improve the quality of tissue, and then we're going to do stretching. We're going to stretch to improve the length of the tissue and improve range of motion. We're going to go into mobility work for the ankle, the thoracic spine, and the hip, try to improve range of motion of those joints. We're going to do muscle activation, generally hip, core, growing area, and kind of turn on muscles and get things activated and working properly. Then we're going to go into our movement prep. We're going to break that up into either linear-based days or lateral-based days. So linear days, we're going to, all of our movement prep is going to be, you know, in the sagittal plane basically. Lateral days, we're going to have left to right type stuff. Movement development, okay, in linear days, that's basically speed development work, okay, acceleration work. On lateral days, it's change of direction type work. Light power is kind of my term for plyometrics and med balls. So we're going to go into plyos and med ball type work, okay, begin to develop power output. Again, that thread or that theme of linear-based or lateral-based work depending on the day. Finally, we're going to have resisted movement, which is basically sled work, and again, it's going to follow that same theme. We're going to do all of that before we touch a weight in our training methodology. Okay, so that's probably 40 to 45 minutes of work before we're even lifting. And again, why that's important to me is because ultimately we're trying to improve movement. Okay, great point by the first presenter that what we're doing in the weight room is not just to do it, just to get a heavy squat or a big bench. It's to improve athletic performance. It's just a tool to improve our athletes. I don't train any powerlifters or Olympic lifters. I train athletes. I train hockey players. So I have to make them a better hockey player, not just a better lifter. So all of that happens before we even touch a weight. Once we get into our lift, okay, we break it up into three parts, an A, a B, and a C series. Our A series, okay, is basically, each one's going to have a quad set, so we're going to do 4 exercises per series. Our A series is going to start with an explosive lift, generally an Olympic lift variation. We're going to follow that with a mobility exercise or a stretch, a core anti-extension exercise, which I'll explain a little bit if you're not familiar with that term, in a moment, and then again another mobility exercise. Our B series, lower body push, upper body pull, core anti-rotation, and mobility. Lower body push, another common term, knee dominant or squat pattern, okay, if you use those terms. And then C series, lower pull, hip hinge, posterior chain, deadlift pattern, etc. Upper body push, a core diagonal pattern, so a chop or a lift type of exercise, and then a loaded carry. We're going to do a lot of loaded carries in our methodology, carrying kettlebells, overhead carries, suitcase carries, things like that. Finally, after our lift, we're going to go into energy system development, okay, or conditioning. We're going to break it up into 3 different systems. We're going to look at either the alactic system, the lactic system, or the aerobic system. Now I start alactic and aerobic because I'll explain in a moment how we kind of develop those. Primarily post-lift, when we do our conditioning work, it's going to be in the lactic category. Okay, so that's usually what we're going to do, the system that we're going to focus on. And then within that, we're going to divide that up into lactic power work or lactic capacity work. Okay, so we're going to try to be as specific as possible. Remember, we don't want work for work's sake. We want to have a specific reason for what we're doing and try to develop a certain quality. So our standard operating procedures, some of the key components in our methodology, things that are sort of always in there that I find to be really important pieces of our programming. As far as tools and techniques, okay, Olympic lifting, I find very valuable. Primarily from the hang, hang cleans, close grip snatch are the 2 exercises that we utilize the most. Unilateral training, again, I think is really important. It has a big role in our program. Rear foot elevated, RFE, stands for rear foot elevated split squat, okay, or Bulgarian lunge, some people call it. A single leg squat, or an SLDL is also in our program a lot, a single leg deadlift, okay, is a pattern that we utilize. Core stability. So core stability training is a really key component in our methodology. And what that means is basically, it's my belief that the functional anatomy of the core dictates that the core muscles are primarily designed to stabilize the spine and reduce motion. Okay, they're not necessarily designed to create a lot of rotation or a lot of flexion of the lumbar spine. In movement, okay, as soon as you stand up on 2 feet, the core's primary objective is to allow force transfer from the legs, from the lower body, the floor, up through the body and out through the upper body. Okay, the lumbar spine needs to stay relatively stable, okay, not static, but relatively stable, and allow rotation of the thoracic spine or the hips. But that lumbar spine area, we want to develop stability through there so that we can transfer forces. So we have 2 basic patterns that we utilize. One is anti-extension, which basically means if this is extension, we're trying to anti-extend, so we're producing forces that the athlete is trying to resist from extension, and the same in rotation. So we're trying to resist forces that are trying to rotate us at that portion of our body. Those are the 2 kind of patterns in our core work that we utilize. As far as methods, I already touched on our kind of detailed movement prep, our periodization and our planning over the short and long term, micro and macro cycles. 4-year planning process is important. Recovery and regeneration is also a key component. Okay, you're only as strong as you can demonstrate on game day. And then velocity is another method or tool that we utilize with some of our athletes, primarily our higher training age athletes. So this is an example of our pre-lift work. I don't know how well you can see it. I don't think it came out really well on the slides. But I'll just give you a brief. So it's a 4-day program. So day 1, 2, 3, and 4. Okay. So basically on day 1, what we're looking at, these are our categories. Foam roll, stretch, mobility, activation, dynamic, movement, power, resisted movement. So those categories I already touched on. I just wanted to give you a look at what our athletes see when they come in. We put this up on, we have the TV in the weight room, and they come in, and on day 1, these are all the things that they're going to do before we get into our lift. Down at the bottom, we have our conditioning work, our ESD listed, which is again going to happen post-lift. And then next to it are just the exercises, the sets, reps. And it's nothing fancy, but I wanted to give you an idea of on paper how it kind of looks for us. All right. A better example, I'll give you A little video, minute and a half or so of our movement prep, sort of condensed version. I tried to hit each category, so I'll try to shout them out as we go, but this is our pre-lift work. All right. Obviously, we're foam rolling. First thing we do. Active isolated stretch. Ankle mobility. They were trying to improve range of motion of that ankle before we get up and start moving. Thoracic spine rotation, okay, T-spine mobility. Hip mobility, active straight leg raise exercise. Single leg hip lifts, so now we're in the activation type work, just getting the glutes fired up and ready to go. In the movement prep,